Hi everyone, I'm Dr. Stephen Davidson, the Sexual Integrity Coach. I am the author of Sexual Integrity, Finding the Courage to Be Yourself. I'm also the author of Peaceful Mind, Peaceful Life, the Guidebook to Happiness. Both of my books are available on Amazon, Kindle, Audible, and fine booksellers everywhere. As a clinical sexologist, I bring you these videos to raise your awareness about sexuality and relationships. Sadly, here in the U.S., we are not allowed to have science-based sexuality education in schools. Even in some colleges and universities that train healthcare providers, they don't offer a single course in sexology, the science of sex. I often complain about that, but I can also do something about it by providing that information myself. This was the purpose of my first book. It's why I write a blog, and it's why I bring you these videos. I hope you will like, subscribe, or check out my website at sexualintegritycoach.com. I recently had a subscriber request that I talk about the difference between a sex therapist and a sex addiction therapist. This is a great request because most people never consider that there is a difference. There is a huge difference in the training and the philosophy of these two distinctly different specializations. However, this is a controversial subject among behavioral health providers. So please bear with me while I try to unpack this as diplomatically as possible. Sex therapists, like myself, are trained to understand the complexity of human sexuality as influenced by our individually unique biology, psychology, culture, and life circumstances. We generally have very positive attitudes about sexuality and the vast diversity of sexual expression as it pertains to gender, orientation, preferred activities, and desired frequency. We want our clients to feel free of shame and to lean into their erotic desires because we know this ultimately makes them happier and their relationships more intimate. Sex addiction therapists are trained to understand sexual concepts through the lens of addiction and trauma. They also want their clients to have happy and more intimate relationships. They help clients abstain from sexual behaviors they judge to be addictive and unhealthy, often using 12-step concepts similar to those in Alcoholics Anonymous. They generally take a more conservative approach to sexuality than those who are trained as sex therapists. The controversy is that many therapists don't believe anyone can truly be addicted to sex, even though many people identify as sex addicts, and some therapists specialize in treating sex addiction. We look to the American Psychiatric Association to establish diagnostic criteria for addictions as well as sexual disorders. Sex addiction has never been listed in either category as a sexual or addictive disorder. The World Health Organization also doesn't recognize the diagnosis of sex addiction, but they do acknowledge a diagnosis called sexual compulsive behavior disorder. While I personally disagree, some therapists maintain that an addiction and a compulsion are the same thing. I am a sex therapist. I am not a sex addiction therapist. But I do work with clients who believe they are sexually addicted, and I help them get clarity about their sexual values, beliefs, and desires. When someone concludes they are addicted to sex, one or more of the following factors exist. 1, they've experienced some consequence to their sexual behavior. 2, They believe that some aspect of their sexual thoughts, desires, or behavior is wrong or against their beliefs and values. 3, they feel shame about their sexual thoughts, desires, or behavior. And 4, they believe they have lost control over their sexuality. They believe they are doing something too much or unable to control their sexual thoughts and desires. Sex therapists and sex addiction therapists will take different approaches to helping clients navigate these 4 factors. Ultimately, all that matters is that the client makes peace with their sexuality and enjoy their sexuality in a way that enhances the overall quality of their life without shame or major consequences. In a previous video, I referenced the concept of ego-dystonic sexuality, which means that the client will judge that they have sexual thoughts and desires, or they have sexual behaviors that are inconsistent with their belief system and their own personal values. So much of what is classified as sex addiction falls into this category. Sex addiction is a big bucket, and we have thrown a lot of things in it that we already understand scientifically as something else. We can have shame about sexual thoughts, desires, and behaviors that are actually a very normal aspect of the human sexual experience. Shame alone doesn't mean that you have an addiction. We know that humans have differing sexual appetites and an innate drive to engage in sexual activity. Wanting sex more than your partner is frustrating, but most couples have differing desires for frequency. Much of what gets labeled as either healthy or addictive is really just a judgment or opinion. We have to look at the unique context of each person's circumstances to help them understand their thoughts and desires and find the resolution that is right for them. You've heard me say before that a one-size-fits-all approach to sexuality is unreasonable because there are so many variables that influence our sexual behavior and our thoughts. As a sex therapist, I have friends and colleagues who are sex addiction therapists, and some of them also identify as recovering sex addicts. In spite of the controversy and professional debates, sex therapists and sex addiction therapists both want good outcomes for our clients. We both want to help our clients make peace with their sexuality. If the sex addiction theory fits for you and it's helping you achieve the outcome you want, that is what matters most. At least consider the debate so that you will be informed and make the choices that are right for you. I'll probably talk about this debate more in the future on other videos to help you understand how this sex addiction diagnosis became so common despite the fact that it's never been scientifically validated. Thank you for watching today. I welcome your ideas in the comments below about other topics you want me to discuss pertaining to sexuality and relationships. Every time you like or subscribe, it helps me reach more people with information they can't easily access otherwise. You will also find links to my books on my website at sexualintegritycoach.com.